Today I'll be doing a lung and thorax assessment on Cassidy. So I'm just going to begin by observing the shape and configuration. So I can see, I'll get you to bend forward a little bit. So I can see that her spinous processes are lined up straight along midline. I can also see, and we'll sit up straight, I can see that her scapulae are both symmetric on either side, lined up equally. I don't see any bulging on either side, any abnormalities. Her ribs, I can feel, are at a 45-degree angle from the spine. And so first I'm just going to begin by checking symmetric expansion of her lungs. So I'm going to begin by placing my fingers at T9 and T10. I'm pushing up a little bit, and I'm just going to get you to inhale and exhale. And once more. Perfect. So both sides move together evenly, outwards evenly, which is perfect. That shows symmetric expansion. So while I'm here, I'm just going to observe her skin. So I can see it's all consistent with her genetic background. I don't see any moles or lesions that raise concerns. And again, we would check the front. And again, I don't see any abnormalities there, which is perfect. So facial expression, I can see throughout the procedure she doesn't seem to have any labored breathing. She doesn't seem in distress. She doesn't seem to be holding herself up to try to breathe and help herself expand her lungs, which is good. She's alert and oriented. And normally we would check oxygen saturation, but we don't have a machine with us today. So some other tips we could pick up on checking oxygen would just be, we would check for any cyanosis, so around the mouth, which I don't see any. We can also check the nail beds, which are pink. I don't see any cyanosis of the nail beds, which again, she's not confused or anything, so again, don't show any signs of low oxygen. So next I'm going to palpate for tactile firmitis. So I'm just going to place my ulnar side of my hand on her back, and I'm going to get her to repeat a word, and I'm going to feel for the vibrations. Okay, so every time I push, can you please say 99?
99. 99. 99. 99. 99. 99. 99. 99.
Perfect. Okay, so I can do it again on the front here as well. Okay, again.
99. 99.
And I'm just going to go underneath.
99.
Okay. Sorry.
99.
Okay, perfect. So again, I felt even vibration on either side. It's a little bit stronger in the left, and it depletes a little bit as we go down, which is perfectly normal. So next, I'm just going to palpate. So I'm going to feel for any lumps or masses. I can warm my hands up. And let me know if you feel any pain or tenderness. Okay, so everything feels good. Throughout the testing, I did her respirations, and they were at 13, which is normal. Normal respirations are between 12 and 20. So next, I'm just going to listen for the predominant sounds in the lung fields. So what I do want to hear over the lungs is a hollow sound. Anytime I go over a bone, it's going to be dull. So I'm going to feel in between the intercostal spaces. So I'm just going to undo this here. Just get in here a little bit. Okay, I'll just turn it this way. Okay, so I'm going to start up here. Okay, so everything felt normal. And again, I can do it on the front here. So again, here we can note it sounds dull over the bone as opposed to the hollow sound in the intercostal spaces. Okay, I'll just here. Okay, so next we're gonna auscultate. I'm gonna be listening for any wheezing or crackling, any abnormal sounds. I'll also note the differences between vesicular sounds, bronchovesicular, and bronchial. So vesicular can be heard just throughout the lung fields. Bronchovesicular will be on either side of the sternal notch. And bronchial will just be up here by the trachea. So I'm just going to get you with each placement to breathe in and out. So I'm going to start here with the bronchial. I'm going to move to the back now. Okay, so I didn't hear any crackles, wheezing, any signs of stridor. Everything her lungs sounded free of any fluid or debris, and I didn't notice any abnormalities. So I would have no concerns for casting today.